Good morning, everyone. I think I can go ahead and open this webinar. Thank you so much for joining, as Sergio mentioned. My name is Simona, and together with Sergio, we will be your hosts today on the webinar titled Digitalization and Homelessness, How to Ensure No One is Left Behind. Thank you for joining as well with such short time before vacation starts, and I hope you will enjoy our conversations today. Our webinar will last for 1 hour and 30 minutes, during which attendees are muted automatically. And however, we would very much like to read your questions in the chat box or in the Q&A section. And we will do our best to answer them during the time that we have available today. So we are connecting, Sergio and I are connecting from Brussels today, and we would be very curious to know where everyone else is joining us from. So if you could take 1 minute to write in the chat box which country or which city are you listening in from, it would be very good for us to know who are we talking to. And we already know that we have our partner and member organizations joining us from Romania, from the Czech Republic, from Denmark, from France, from the UK, as well as from Spain. So it would be nice to know who else is with us. Oh, we already have some answers. Yes, we have Luxembourg, Denmark, as we've said, Sweden, St. Martin's Charity in London, Brussels, Dublin, Vienna also, Barcelona. It's very, very good to see that this topic is of interest across Europe. So thank you so much for joining, and please, you are welcome to write in your questions in the chat as we go along. As I said, the webinar is being recorded and it will be later available on our YouTube channel and FANSA's YouTube channel. And a little bit about why we decided to organize this today. We found it very relevant at FANSA to discuss about digitalization in a time where Europe is becoming more and more digitalized, and this has been accelerated by the pandemic. At the same time, the European Commission is developing initiatives to make the next decade Europe's digital decade. So we at FANSA wanted to look at what can be done to ensure that homeless people are not further excluded in a digitalized world. So to achieve this, we started with analyzing what were the risks that homeless people may face if they remain digitally excluded, and what are the benefits of digitalization for people in homelessness. We also wanted to look at what are the challenges regarding digital inclusion of the homeless and what are good practices to overcome these challenges. And the answers to these questions and more are now available in our policy paper that we will present today, and which can be found on our website starting of today. Now, preparing the analysis on the subject of digitalization and homelessness was possible only with the great contributions from our FANSA members and partners who have developed and implemented projects to overcome exclusion of homeless people from a digitalized world. So we are very happy to have together with us today several of the organizations who contributed to this policy paper, from which we will have the pleasure to hear about their experience with digitalization and homelessness. And following their presentations, we will also provide you with a quick overview of the policy paper. The next step after that will be to have an open floor, an open debate, where we welcome everyone's questions, and we will discuss in detail the experiences that we will present and the recommendations and suggestions from the policy paper. And also, we are very happy to have with us today for the debate and in the closing of our event, but also joining right now, I can see Ms. June Lowry-Kingston, who is head of unit at DigiConnect at the European Commission, working on accessibility, multilingualism, and safer internet. Ms. Lowry-Kingston was very kind to join us, and she will talk to us more in the second part about the work that is organizing and coordinating at the level of DigiConnect. Thank you all for joining. So without further ado, now I will pass the floor to Sergio, who will introduce the speakers, and we are looking forward to listen about your experiences. Thank you so much. Sergio, the floor is yours.
Yeah, so good morning, everyone, and thank you so much for joining us. So now we're going with the presentations, and for the first session, we will have 5 organizations from different countries talking to us about how they work to improve access to digital services for people. First speakers will be Zdeněk Trinkewitz and Andrej Doubek from the Czech Republic, who developed the app Mapa based domova. The purpose of this app is to improve access to information about support services for homeless people. So thank you, Andrej, for joining us, and the floor is yours.
Thank you. All right, so may I just ask if you see my presentation now?
Yes, we can see it.
Yes, perfect. Okay, so good morning. I'm Andrej Doubek from the Czech Republic. Together with Zdeněk Trinkewitz here and Martin Juričetka, which cannot be here today, we would like to share our experience with the project Mapa bez domova, which the closest translation to English is the homeless map, the online project focused on the better access to information for the people experiencing homelessness and people in crisis. As an introduction, the project started back in 2016 as a start or the baseline. We started with the CRISA group, which is the Critical Social Work Platform, group of the volunteers in the area on the social issues, together with the coordination with the Jako Doma Home-like private organization working with the homeless women. We met there as a group of the volunteers and use our knowledge and expertise in this way to create this online project. The motivation originally for this project are the specific needs for the homeless people without home, and people in crisis, for the information and the structured information, and also for the volunteers or professional community needs of this information in the more structured form. The original state and even currently present state of the publicly open data or government data had issues. Then they weren't presented in the accessible way. They weren't case-oriented, mostly organized by the legal requirements by the service providers. Not always had up-to-date information or missing very important information which were well known about the services for the community or the expert area in the field. And in addition, there wasn't any main hub for the services which are non-official, are not registered here. For example, the food not bombs for the free food, or even the public showers, the hygiene. We have commercial temporary accommodation, which are very widely used here in the Czech Republic for people in crisis or experiencing homelessness, or information for this commercial temporary accommodation about the labor office allowance, which you can get here to fill the financial part. So this is the motivation for the challenges for creating this kind of project is for, of course, gathering of the data and enrichment them with the relevant information and keeping the data set up to date. That's most important part for this kind of the data-based project and growing, expanding. As a baseline here for the digital service accessibility directly for people experiencing homelessness here in Czech Republic area, there is like global trend of the growing smartphone usage according to experience of the professional workers here. We have quite specific situation with the mobile data. Historically, we had historically most expensive mobile data in the Europe. So because of that, the Prague, for example, larger cities have quite dense network or the free Wi-Fi zones. So digital services can be accessible in field without much additional financing, usually. For our solution, which are currently in production and used, we created online web-based platform with the administration system, which is important part, and the update information automation together with the official registries. Most important is the accessible user interface with the ability to search, filter, and print. We started with the Prague data set, basically gathered physical materials and convert them to the digital form with the help of the community admins, various NGOs in Prague and other regions. We expanded through the Czech Republic to Slovakia. This is our landing page. And then the data set of our projects, Prague, Ostrava, Liberec, Bratislava. There are two crucial parts to keeping data up to date here. The admin activity, which administrators usually have the responsibility to growing data set in the area and even gather and confirm the community feedback, because one important part is like we have a public feedback forms to updating the data about the services when they are outdated or need an update. Second part here is the accessible user interface, and that's for the people directly experiencing homelessness or the professional area working or the volunteers working in the area. So as I mentioned, case-oriented categories, for example, official services, shelter, low threshold centers, counseling, psychological, low counseling, financial, some categories, for example, focused on the domestic violence, and plenty of the additional actually official categories. And then even non-official like food, coffee sharing. Important part here is the mobile phone chargers, for example, the map when you need to have an access, you need to charge the mobile somewhere, or the hygiene, or the commercial accommodation, which are widely used here. And these categories extended by the tags, which are quite important. For example, for the commercial accommodation, there's very important information sometimes if the dogs are allowed in the rooms and are by the regulations there. So this is like introduction. This is the basic view of the project. And for our experience, we came after a few years from the volunteering project for the needs of the volunteers, some sort of the data hub in Czech Republic in this area. So the project is used both in the homeless people directly sometimes, but mostly there is secondary propagation of the information from the professionals and professional services. So some professional services using our tool for example, for the database of the winter intervention, or using the homeless map as the analytics tool. In additional users, there are municipal offices using our tool, Czechoslovakia ministries, hospitals very often, and not last NGOs, which are providing and need this type of the case-oriented information. An additional important part is the, for example, media coverage. After we started this project, was based on this raising public awareness about the digital inclusion of the homeless people and ability actually in the public to know that homeless people or people in crisis can use the digital tools for getting the information, or participation on the community events, or impacts on the community of the professionals, which mentioning the project in the publication, or some practices to, for example, engage homeless people in the updating the map, for example. This is one photo from the community event. And for our experience during development of this project, more on the technical side, there is huge importance for this project to have the open data, open government data in the machine readable form. That is actually speeding up a lot the whole development of these specific focus projects. And for example, sometimes the complex tools as this are less flexible for short-term time, which is our experience with the COVID-19 pandemic, when we needed to get plenty of the new information quite fast through the various organizations. So for these cases, short-term is sometimes better to use, for example, shared documents, which are publicly available. As our plan in the future is we planning to add the ranking for the commercial temporary housing, some information about the services capacity the official organization can use, and stay updated and help where we can with the collaboration through the Czech Republic and maybe European Union. And that's it. Thank you very much. Here is the contact if someone wants to ask further questions.
Thank you, Andrej.
Yes, thank you, Andrej, for your presentation. Let me just ask if you could stop sharing the screen.
Yes.
To give the floor to the next participant. Okay, perfect.
That's it.
So now we're going from the Czech Republic to France. In France, the organization Fédération des acteurs de la solidarité is implementing the project Marot-in, under which they work with digital solutions for outreach workers. And now we are joined here by Sarah Sheklap, working for this federation, and she will tell us more about this project. Sarah, the floor is yours.
Thank you very much, Sergio, and good morning, everybody. I'm in charge of data protection, digital inclusion, and access to rights in the Fédération des acteurs de la solidarité. That is a federation which gathers more than 870 structures fighting against social exclusion of various public and notably the homeless people. In this context, I'm in charge of the project called Marot-in, which aims at promoting access to rights for homeless people with the support from the AFNIC Foundation. This is the foundation of the French agency dealing with domain name, and the Mednum, which is a French cooperative gathering actors of digital mediation. So considering the growing part of digital technologies in today's society, it has impact on the inclusion of the individuals living in extremely precarious conditions. Indeed, according to the Société Numérique, which is a French authority, 13 million of French persons are far from the digital world. Besides dematerialization of administrative procedures and the growing role of digital technologies are transforming the practices and the missions of the outreach social workers. And also these are changing the needs of the homeless. And contrary to common beliefs, the homeless people are not disconnected from the digital technology. And at this point, the Solinum study found that 91% of the respondents, which were homeless, have cell phones, and 71% have smartphones. But there is disparities in access and use of the digital technology. And in particular, this study shows that more than half of the homeless people never do their administrative procedures online. And another studies which has been led by the Fédération des Acteurs de Solidarité observed the same problems. And that's on that basis that we decide to build the project, helping the homeless people to be included in this digitalized world. So this project has begun in January 2021 and is intended to last 2 years. During this first year of experimentation, we are going to implement the project through 6 structures, meaning 6 teams of outreach social workers. And our project pursues 2 main purposes. The first one consists in helping the outreach social workers to acquire digital equipment as cell phones, electronic tablets, charging stations for electronic devices. And they will use these in order to assist the homeless to begin their administrative procedures and to provide digital equipment for the more autonomous homeless people. And the second purpose consists in training the outreach social workers to the digital mediation practices in order to help the homeless to accomplish their administrative procedure as, for example, finding an accommodation. As in France, there is more and more administrative procedures which are dematerialized. And the training of these outreach social workers will be handled by a professional of digital mediation that will be trained by our partner, the Mednum. And moreover, we built also with the Mednum toolbox that contains resources to help the homeless people to have access to their rights. And at this point, we are also working with the association Solinum, which has created the Soli Guide. In a few words, the Soli Guide is an online platform that references useful and accessible places and services for people living in precarious conditions. And the next steps of our projects is the equipment of the outreach social workers, which is in progress. The next one will be the training of the trainers this summer and the training of the outreach social workers in September or October. And the last step will be the evaluation of the project. This is the last step for this year's, which will be implemented at the end of the year, and the preparation of phase 2 in 2022, which deals with the implementation of the project through 10 more structures. So thank you very much for your attention, and if you have a question, do not hesitate. Thank you very much. And sorry for the noise. There is the building. My building is restoring. Thank you.
Okay. Thank you so much, Sarah, for your presentation, and yeah, for giving us a little bit of information about these interesting projects that you're doing at the Fédération. And now we're moving to Romania. We have here Nicoleta Dinu and Ian Tilling from the association Casa Joana. They will tell us more about how they use technology to support homeless people in accessing healthcare during the pandemic. So thank you, Ian and Nicoleta, for joining us, and the floor is yours.
Thank you, Sergio. 1 second. Here we go. Okay, my name is Ian Tilling. I'm the founder and president of Casa Joana, which is a Bucharest-based Romanian NGO. This presentation looks at the challenges facing the Romanian healthcare system and the issues that families experiencing homelessness are confronted with when trying to access healthcare. Casa Joana, a Romanian NGO, as I said, has teamed up with the telemedicine company Telios to help improve access to adequate healthcare for our clients. Romania offers, at least in theory, the benefits of a universal healthcare system. The state finances healthcare with the Ministry of Health managing and supervising the public healthcare sector. Citizens have access to cost-free, unrestricted medical care, providing they have paid their state medical insurance fee. State medical insurance is generally obtained through taxes paid by employers and employees. If a person is receiving welfare benefits, the state covers the insurance cost. Children and young people under the age of 18 have free access to healthcare. If an uninsured person requires urgent medical attention, they're entitled to 72 hours of emergency healthcare. There are, however, challenges in accessing healthcare for those confronted with homelessness, principally because they are not in formal employment or receiving state welfare benefits. Additionally, they cannot afford private health insurance. Difficulties exist for people experiencing homelessness and their access to the welfare system, which inhibits their ability to receive state health care. Firstly, many lose or have had their ID card stolen, meaning that they have to obtain a new ID card, not an easy task. Welfare claimants can only apply for help from the local social services department where they last officially lived. Many people experiencing homelessness and living in Bucharest have travelled from rural areas to seek employment. Others were unable to obtain a rental contract from their property owner because of tax avoidance issues. So obtaining an ID with a Bucharest address was nigh on impossible. Besides, welfare payments are so low here. Very often the income from begging is higher than the state benefit. Lastly, there are so few family doctors who are key in being able to obtain specialist services that their allocation of patients have been met and they are unable to accept new clients. Healthcare in Romania ranks last in Europe. Romania regularly falls around last place in the European Health Consumer Index. It consistently spends around 4% of its GDP on healthcare, which is one of the lowest rates in the EU. The system is underfunded and inefficient, which consistently fails to provide quality care. Poorly trained staff often does not follow proper medical procedures and expose patients to unsanitary conditions. The government plays a large role in the failures of healthcare in Romania. Romania consistently spends, as I said, around 4% of GDP on healthcare. In addition to health insurance, the government also operates a majority of the hospitals in the country, many of which are aging and chronically underfunded. The country has built very few new hospitals in the last 30 years. Low salaries are driving corruption. Despite having universal health coverage in practice, many Romanians end up having to pay out of their pocket to get quality care. Underpaid hospital staff usually receive bribes to get their attention. This culture of bribery has become a huge problem for many Romanian hospitals. There is also a shortage of doctors in Romania. Romania's entrance to the EU allowed more than 15,000 doctors to leave the country in search of jobs with better pay in other European countries. There is an acute shortage of healthcare professionals in the country, with about 30% of positions unfilled. The situation is worse in rural areas where salaries are lower and there is less oversight. Medical graduates and skilled doctors continue to leave the country as hospitals have unfavourable working conditions. Casioana is a Romanian NGO based in Bucharest and supporting women and children confronted with domestic abuse and family homelessness. It provides temporary accommodation for up to a year if necessary for 9 families, including 22 children at any one time. A great deal of emphasis is placed on empowering our residents so that when they leave us, they have the skills to manage any further crisis. A multidisciplinary team of social workers, psychologists and volunteers provide regular workshop training to clients in the areas of health and personal care, anger management, childcare, and a host of other soft skills, including soft skills for the workplace. Families are helped to place their children in local schools or in after-school clubs, thus enabling mothers to get employment. When they feel they are ready to move on, mothers are helped to find suitable and affordable rented accommodation. Accessing social housing is very difficult because of a shortage of social housing and a complicated system for housing allowances. Casioana has another centre in Bucharest, which is waiting for a major refurbishment and will serve another 7 families, including up to 18 children. Telios is a pioneer of telemedicine in Romania and was launched in 2019 after 2 years of developing their platform. They have quickly attracted some of the biggest insurance companies as strategic partners, gaining big corporate customers and significantly increasing their call volume. Their customer base now varies from corporate employees and 5-star hotel guests to truck drivers. Telios is currently developing an AI-powered app for self-diagnosis, which they plan to launch soon. Telios have developed CSR projects serving people experiencing blindness, another serving people in remote rural areas, and lastly, serving Casioana's residents. The company is expanding into Hungary, Poland, and Greece. In 2020, Telios approached Casioana and asked us if they could serve our residents, our clients, by giving them free access to their platform, the telemedicine platform. The access to the service is through the resident's own smartphone, or we have a dedicated computer in the general area in Casioana, which gives 24/7 access to Telios and other internet services. So the deal is that Casioana clients can use Telios services to consult with a doctor, explain what their problem is. So a trained nurse initially takes over and completes a medical history and tries and gets the client to give the symptoms so that the doctor is well prepped before the resident speaks to the doctor. Also with the platform, a client can actually upload any documents they want to share with the doctor, such as previous records, previous medical records, other diagnoses and so on. So in Romania, it is the patient who keeps the records has a personal copy of all their medical records, as well as the family doctor, if there is a linkage there. So the doctor will diagnose the condition and recommend a treatment or various treatment options. He can prescribe what drugs are required and provide medical reports, which can also be downloaded. Once a week or two has gone through, or earlier if necessary, there is a telephone call up after the initial consultation. So the doctor will phone the client and ask how the treatment is going, and whether there is a new consultation needed if, for instance, there is no improvement in their condition. Teleios is very big in the US, which is where it started, and they have access to, so the doctors here with Teleios Local have access to consultants in the US to get second opinions and so on. So the package is a great benefit to our beneficiaries. As you can imagine, it provides quality healthcare, although in a digitalized format. Castellano's clients are covered whilst they're resident and generously for 1 year after leaving the refuge. So thank you very much for your attention, and I look forward to answering any questions you might have later on in this seminar. Thank you very much indeed.
Yes, thank you indeed, Ian, for your presentation and for explaining the details about this important partnership with Teleios to provide telemedicine in the during a global pandemic, which hugely affected homeless people. And now I give the floor to Rebecca White, CEO of the organization Your Own Place in the UK. And Rebecca will talk to us about the digital inclusion work with people who have experienced or are at risk of homelessness. So Rebecca, the floor is yours.
Hello, good morning, and thank you so much for having me. And I must also thank Julie from Homeless Link in the UK, who was unable to be here and asked me to step in. I'm also acutely aware as I look across so many people across Europe that we're here speaking English, and I'm always incredibly humbled and grateful, and you're all brilliant because you're doing it in a second language, so thank you. So what I want to talk about a bit is Your Own Place, based in the southeast of England. We exist to prevent homelessness. We do work with people who are homeless, but often people more at risk of homelessness. We work in East Anglia, we work nationally. As a social enterprise, we really go where we can have an impact. But I've got 7 minutes, so I will absolutely crack on. What we do to prevent homelessness is we provide tenancy and independent living skills, workshops, small groups, participative, engaging, small peer groups. People learn from each other. It's restorative, it's asset-based. But of course, like everybody across the planet, we were plunged into COVID last year. We couldn't do it face-to-face, so we had to go digital. So what did we do? Because we couldn't any longer get people actually in a room. We did that. We listened. My amazing small team picked up the phone and talked to people, not just to find out how they were, but to really understand what were the barriers they were facing to being online. It became apparent, more apparent to us than ever, that the world was going to be online. The world was digital by default. So I asked my team to listen, to record, to collaborate and to share. On our sharing mechanism, we use Trello. So we really could get everything down to develop our own digital inclusion framework. What that meant is that we had to go away and create a digital offer to match our participative and face-to-face one. And the team were utterly committed to maintaining our values, ensuring that it was totally accessible and that our values and approaches remained the same, whether we're online or whether we're face-to-face. But here's what we learned. We identified 10 digital inclusion barriers. And of course, it shouldn't need saying that people who aren't homeless or at risk of homelessness also experience these barriers, and that they can come in any shape or form and that they are a very fluid spectrum. So this was the first one, a lack of a device or a working device or a functioning device. In the UK, it's the one that's spoken about most, that got probably most media coverage, is when people simply don't have a device to get online. And of course it is a massive barrier, but it really is only one part of the picture. The second part of the picture is poor Wi-Fi. I'm here in central Norwich. I have decent, good urban Wi-Fi. That is not the case across the UK. Many people are still living in areas where the Wi-Fi is very intermittent, very poor, or even non-existent at all. And of course, if you're living on the streets, you may be on 4G, which means you're not going to be able to do a lot of the interactive work that we do in our online delivery. Many of the people we support have English as a second language. We know people from overseas are disproportionately represented on our streets. It makes everything harder. That's the reality of digital exclusion. Stuff that's hard in the real world is also hard in the online world. So of course, it's going to be more difficult to navigate in that rather two-dimensional world. It's also difficult to connect to a device where the instructions are in English and everything gets very, very complicated. We also, unsurprisingly, work with people with a range of learning difficulties. Face-to-face, our delivery is highly adapted to a very neurodiverse audience. But again, doing that online is really, really difficult. And many people we experience suffer acute challenges, difficulties, learning difficulties, as well as, of course, mental health conditions. For many who we were supporting to get online, actually getting online is really hard. As I said, the instructions can be complicated. Understanding the jargon, navigating, troubleshooting, making your device work. This can be really, really difficult. Imagine if you're in an unsafe, unstable, changing situation. That's another digital barrier. Many of the people we're working with lack confidence. People need confidence to ask for help, to get help, to know where to get help. It might even just be asking a family member. But if you're lacking confidence, you're less likely to go and get the help you need to get online. We had a scheme in the UK called Everybody In very quickly last spring to get rough sleepers off the streets. But many of them found themselves in hotels where the Wi-Fi was very poor. Many didn't stay in those hotels. They didn't feel safe there and ended up in other unsafe situations. If you're not in a safe space, it's going to be very difficult to do any learning or any access online. Money, it shouldn't need to be said, but of course all of these are connected to poverty, and COVID has shone a light on poverty. So this is absolutely a barrier to a decent device, to Wi-Fi. We know people, of course, who are at risk of homelessness are likely to be on lower or no income at all. This one's really important for us at Your Own Place. This is about our own assumptions. So important to challenge our own assumptions and those of our partners and the media about the lives that homeless people lead. Actually, lots of people are on devices. Lots of people do have digital skills. So we have to be really careful about our own assumptions of what the digital inclusion barriers people do and don't face. And I do regard that as an important element and one of the 10 digital inclusion barriers. And the final one is people with criminal convictions. We are working with a disproportionate number of people with criminal convictions. If people have been found guilty of accessing certain illegal content online, they may well actually be not allowed by law to go online. So of course, if you can't actually go online, you can't access all that is online. So we know that digital is here to stay. So for us, it was really important to make some changes to our delivery based on all of that learning and that recognition of those 10 complex interplaying digital exclusion barriers. So what do we do now? We measure our digital outcomes. We've always had some digital content, but we now actually measure the outcomes, capture information about the baselines, about where people are on their digital confidence, skills and access, so that we can really report back to our commissioners about the distance travelled and about the difference our interventions have made, because we know that's going to be important for commissioners in the future. We're marketing our added social value. What do I mean by that? We are now improving digital skills. By improving digital skills, we may be improving people's connections, people's well-being, people's ability to get a job. That's huge added social value that we do beyond just preventing homelessness. We're promoting the true cost. I was very worried that there'd be a quick race from commissioners and funders to say, well, isn't digital cheaper because you're at home and your overheads are cheaper? No, because all that work that goes into overcoming those digital barriers actually takes a huge amount of time and preparation on the part of my team. So I think we all have a collective responsibility to be really honest about the work we're doing and about the true cost of this. And that's a really live debate being had in the UK. And we're finding new partnerships. We're a small organisation, but if we're commissioned by a housing association or a local council, we're working with their digital inclusion departments so that we can together collate our resources and get the right device, the Wi-Fi, the credit, the MiFi, whatever it might be that the person needs. We're making sure we get that to that person by working together with our partners who might have more resource than we do. And at the moment, we're really excited with our local city council in Norwich to be conducting some peer-led research, literally surveys going out the door today that have been designed by people at risk of homelessness in order to go across to organisations to hear the voice of people that often aren't heard. What do they think their digital inclusion barriers are? What do they think the impact of that on them is? And what do they think the solutions is? Including, not everybody wants to be, and we have to really, really respect and understand the reasons for that. That's me. Thank you very much indeed for listening.
Indeed, thank you very much, Rebecca. And I think that your work is or can be very, very inspiring for other service providers in Europe, actually, who tackle also the same issues. And finally, we're joined today by Ferran Busquets, director of Arrels Fundació in Barcelona. So he will tell us more about what are the challenges that they have addressed and how they managed to solve them. So Ferran, now the floor is yours.
Thanks to everybody and FENSA to help us to provide this space to talk. After that very interesting presentation, so I will try to not repeat a lot, but I think we can provide some information. Okay, we are first of all, we are an organization based in Barcelona, and we attend help to near 2,600 homeless people in the city through the year. We have 210 people hosted every day in flats, residents for people with organic difficulties, and low requirement spaces. And so we have a day center and an outreach team, and finally we have a workshop for people occupying time. And most of our people are qualified people. One of the important things that we have near of 300 volunteers that in the pandemic we have the number have lowered, and near of 80 staff people working for us. But for the most important thing is that we work with very qualified homeless people. And of course, when we talk about digital inclusion, that's a real challenge. And one of the things also is that, as you know, most of the public, or maybe you don't know, but here in Spain, some of the public services are going to digital solutions that only that the people only have access, or the access is pretty difficult if you don't have internet connection, for example. And the COVID show us that that bridge is really bigger. For example, to get a minimum wage here, you need internet access. To get the COVID vaccine, you need also internet or phone access, and if not, you also can have it, but they are not pretty easy. And for homeless people, if it's someone that is near to an organization that can help you to solve it, it's pretty easy, or you need it's relatively easy. But if you are someone that are in the street but don't want to have contact with the organization, or simply you don't have it, then it's really hard, or it's mostly impossible sometimes. Then the most of the challenges is that that the digital bridge have provided us more difficulties than in regular situation, and also that for an organization like us that we work very hard for participation of homeless people or client users, and have been the most important difficulties for us, because we have find that the participation was lost because the digital bridge, and we make an effort on that. Of course, in the people on the street, the most problem is that the phones get lost, broken, stolen. And for example, we provide guides for the people in the street, guides about resources, but it has to be in paper, because if we make a digital resource or guide is not able for people in the street, then we have to give them on paper. Of course, also in our day centers, we provide, as ever, mobile church internet access, and we have to provide more intensive information, because in the pandemic situation, the people request more information and need more information that without internet you don't have. For the housed people, we realize that there are some people that request more in-home internet access, and we are thinking about that the internet access have to be in the same level maybe that electricity or water, but we usually don't think in that when we talk about social services, like we have seen, for example, with children in the schools, no? But in homeless people, if the people before the pandemic they could have internet access, it could be it could be a very more easier pandemic. Okay, but the reality is that some people request computers, some people request tablet, but not everybody have the abilities to use it, and people need sometimes a lot of training. And usually the phone calls have been the easier way to provide this. We have an interesting experience with the residents we talked about before, that the volunteers react the homeless people in the residence, but by the video, by Zoom, by video conference, and they had a very, very good experience. But that's what possible because the residence has the technology there. And when we talk about participation, people participation, we have participation in different levels. For example, we have homeless people in the board of directors. We have people there, and we have to provide them access to internet, or for example, prepare in our center space and in city support to connect the meetings, because if not, the people cannot connect in the meetings of the board. And also, if when you have presential meetings, it's difficult for them to talk. With remote and video conference is absolutely more difficult. We have to help them also in each meeting that we make. For example, with meeting with volunteers and all the staff in the organization, we have to make one of the things that works for us a lot is the on-site support for them. It's very, very important. As a conclusion of all of this, I think that we have to provide internet access for the people that can use it, and maybe it has to be in the same level of electricity or water. Also, the volunteers and social workers equipment also is a very good way to reduce this bridge. We have to provide some volunteers and some social workers more good equipment to make easier to break that bridge. And also, finally, is that as you know, not everybody will join the digital world, and some of the homeless people, they will not be able to do it. Okay, I think it's a time. I think that's all I wanted to say. Thanks for all.
Thank you so much, Ferran, for your presentation. And yeah, from your words, I would highlight the fact of pushing for digital tools to be considered a basic amenity, such as electricity or water, because right now for almost everyone in society who has access to digital tools, they are very important to look for a job, look for a dwelling, etc. And homeless people are excluded from that, so they're excluded from the same rights and the same opportunities that the rest of the population enjoys. So yeah, I think that's very important. And also the fact to train and to give equipment to staff also is very important. So thank you everyone for these great contributions. We finished now the first part of the webinar. And I would mention that those of you that who are interested to hear more about these projects, as well as other initiatives, you're invited to read the policy paper, because most of the organizations that presented their projects here are also participating in the policy paper. So we will share with you the link later on. And now, as we are running a bit out of time, we're going directly to present the policy paper that the FEANZA team drafted regarding digitalization. But in any case, if you have any questions for the speakers and for the presentation of the projects, you can also ask them in more or less 10 minutes when the open debate starts, okay? So yeah, feel free to make any questions and write them in the chat or in the Q&A section, and we will answer to them very soon. Okay, so now we are going to start presenting.
Yes, if you share your screen, Sergio, I can start by introducing a little bit. I've already mentioned in the introduction, but briefly why we wanted to focus on this subject. It was because digital inclusion was always interesting for us at FEANZA, specifically the access to information and communication technology for homeless people. It was always a relevant issue for FEANZA members. And in recent times, with the global health crisis, which meant the transformation of most public as well as private services across the EU to an online format, as we've heard also in the presentations, this topic became even more pertinent for us. And therefore, we decided to investigate more on these issues and to look at the benefits and challenges, as well as solutions for the digital inclusion of homeless people. Next slide, please. Thank you. So we decided to do this as a response to the changes produced during the last year, and also in the setting where the European Commission has prepared the strategy for a European digital transition, mentioning that the digital transformation can only work if it works for all and not only for a few. And then there were several initiatives published at the level of the Commission, for example, the Digital Education Action Plan for 2021-2027, or the Communication on Shaping Europe's Digital Future, on which you can find more details in the paper. And our aim is to contribute to this objective by ensuring that homeless people and homeless service providers are included when formulating and adopting digitalization policies. This is why the objective of the policy paper is to contribute to the debate on digital inclusion among marginalized groups, particularly regarding people experiencing homelessness. To this end, we analyze the benefits, challenges, and we provide evidence to policymakers and service providers on how digitalization in our societies may negatively impact homeless people as a consequence of a lack of policies and measures targeting this population. And just a few words on methodology. We based this work on previous experience of the participation cluster of FEANZA, whose members have developed digital initiatives as part of their services providing to homeless people. And some of them we've heard from in the presentations earlier. But yeah, we also conducted interviews. There were 11 interviews with homeless service providers, app developers, and individuals with expertise in the tech for good domain from Spain, France, the UK, Romania, the Czech Republic, Denmark, or Luxembourg. And the information collected will be available on our website. We will paste the link in the chat in a moment. So I will let Sergio tell you more about what were the challenges and the benefits that we identified, and I'll get back later on the recommendations we formulated. Sergio.
Okay, now, sorry, I was muted. Yeah. So first of all, it is very important to consider that homeless people are not per se digitally excluded, and straightforward assumptions in this sense may oversimplify the issue. For example, a recent study from 2018 among homeless people in France, the study that was mentioned before by Sarah, study by Solinum, found now that 91% of those interviewed had a mobile phone and 71% a smartphone. However, it is very important to know that only 55% of the respondents to this study used internet every day, and up to 62% never did administrative procedures online. In addition, only 57% of the interviews had a personal email. What does that suggest? This suggests that even if people in homelessness are not per se digitally excluded, they face many challenges and barriers that prevent them from fully participating in digital society and from enjoying the benefits of the digital transition. Homeless service providers, staff, and thus working with people in housing exclusion recognize the importance of these tools, digital tools, and of digitalization in their work to support people into safe and adequate housing. Digital tools can facilitate their work and develop innovative professional practices. At the same time, professionals themselves continue to face several challenges and inconveniences of digital transition, which shows us that there is a need for support in developing digital skills for staff as well as for people experiencing homelessness. Regarding the benefits and outcomes that digital tools can bring to people experiencing homelessness, we must say that, first of all, access to ICT, as I said before, is becoming increasingly important for vital tasks like searching for a job, a dwelling, healthcare, accessing social assistance, and other services. Nowadays, most of the population would find it unthinkable to do such tasks without using the internet. For people experiencing homelessness, access to ICT is crucial also for keeping in touch with family, friends, social workers, or peer support groups, or to get information about where to eat and sleep. It can even, for some individuals, lead to finding a way out of homelessness. From the evidence gathered through research and the interviews that we had with service providers, we could identify several benefits and outcomes of digital inclusion, starting from the level of basic needs to specialized services. For example, apps with information on available resources like Open Help, Mapa, domova, or Soliguide. And also migrants, asylum seekers and refugees, or women can benefit from the internet when they look for specialized resources, or even for translations in the case of migrants. Other found benefits of digitalization are, for example, better social welfare. Tools like WhatsApp and social networks can be used to fight isolation, which affects largely people in homelessness. Improved access to medical care, as the presentation of Ian demonstrated. It has also been an advantage, for example, having video calls with doctors or nurses to seek first advice. And finally, a common conclusion in the interviews was also that digitalization allows for people to be empowered and gives them a sense of autonomy, which is also beneficial in terms of enjoying the same rights and opportunities in the digital world as any other citizen. That being said, digital inclusion is not easy to ensure for homeless people, and we could identify a number of challenges on different levels. Firstly, it is important to note that most of the people in homelessness are not completely offline. Instead, the challenges consist of barriers they face when trying to move online. Some of these challenges have to do with, first of all, affordability, as many people do not have the necessary resources for buying a smartphone or ensuring a data plan for calling and accessing internet. And for those who manage to keep a device, there are problems with the lack of charging stations or the Wi-Fi connection, for example, as the presentation of Rebecca already mentioned. And finally, for the service providers, a lack of appropriate equipment, if there is equipment, has been identified, as well as questions from the staff related to how much this type of work is part of the social work they do. And finally, some ethical concerns of social workers in relation to personal data protection were also raised. Other kind of barriers, finally, are related to digital skills. They have to do with the poor or lack of digital skills for both homeless people and the staff supporting them. And of course, the design of the online platforms, which are in most cases not very friendly for marginalized users. And finally, in the case of migrants, the language barrier needs also to be considered when moving online.
Thank you, Sergio. I will do the last part about the recommendations that we came up with after writing the paper. So our purpose was to demonstrate that digital transition can bring enormous and varied benefits for people in the institution, including homeless people. At the same time, we want to raise awareness that if challenges regarding inputs and digital skills are not addressed, this digital transition may further exclude people in homelessness. So in order to overcome the identified challenges and to ensure that homeless people also benefit from the accelerated digital transition of Europe, we have a few recommendations. I will just briefly mention a couple of them as we are short on time, but indeed we would like to see more funding and more research on how digital transition, more funding and conducting more research on how digital transition affects people facing social exclusion, homeless people included, as we are lacking data on this subject and we need to know better what we are confronting with. And our paper is a small step in this direction. We also would recommend establishing funding mechanisms at European and national level to provide people in the institution with devices and other tools and improving skills for those who want to become more digitally trained. And as well, we think it would be important to coordinate and establish partnerships between governments, the tech sector, and civil society organizations who work with people in the institution. And this has been possible, as we've seen in Jan's presentation, in the case of Romania, and in other presentations from today as well. So we would hope that these recommendations will be in the future put in practice. Yeah, these were the main findings of the paper, and I think, Sergio, we could maybe post the link in the chat box now so everybody could read more about it. And thank you all for listening. I can see that we do not have questions at the moment, but I will encourage you to write in if you have questions to any of the presenters from today. Yes, and now I think it's time for the open debate that we've been mentioning. We would like to welcome Ms. June Lowery Kingston, who is with us today from the DigiConnect. And she is head of unit at DigiConnect, working on accessibility, multilingualism, safer internet, and she will tell us more in a few minutes about their work. And also our colleague from Denmark, Anka Kotinan, who is a cultural counselor at Fidekelen Kirkens Kose, a FANSA member in Denmark. So while we wait for collecting some questions, I would like to invite Anka very shortly to also tell us about their work in Denmark and what do you do for furthering digital inclusion. Thank you, Anka.
Thank you, Sergio, and thank you for the creation of the policy paper, and to all the panelists who spoke today. Thank you for your insightful ideas. It's good to learn from good practices. I'm working for Kirken Korse. It's an organization in Denmark. We have several day shelters and night shelters. We provide counseling, healthcare, and accompany people to various institutions. We work with homeless people, that's our target group, and also homeless migrants. Personally, I've been participating in the creation of tool of a way of digital inclusion through making a photo exhibition where the homeless guests that come to our shelter took photos about regarding the public space and their livelihoods, and we had both an online and exhibition and a live exhibition where we tried to raise awareness towards the difficulties of homelessness. And yeah, this is was very also insightful for us to see that they were using their smartphones and digital devices, and not the one-time use cameras that we also provided them. So, but of course, as all of you said, we face many problems in terms of our guests not being able to use their smartphones, even if they have it. So we are actually digital mediators in a way, because we try to help them out to learn basic digital skills in order to become independent and socially included, because that's the goal. And our focus will be moving on to have targeted workshops and a very clear framework in regards to digital inclusion. Yeah, but in a very holistic way, using empathy as our main focus, because we don't want to lose the human connection. Yeah, thank you.
Thank you, Anka, and thank you everyone for today. I think we have started to receive in some questions. There's a question for Andrej. If you would like to answer, it says, do you have access numbers to the homepage? Is it well used, and how are you promoting the service?
Yes, so that I suppose means if we have like some analytics about information about our guests on the page, we can share maybe more in detail. I had brief chart in the presentation. We are mostly accessed from the computers, not the smartphones, since that's the result. Our app mostly using the social workers because of the lack of any the kind of structured data, and the promotion mostly is very natural through the sharing of the information and experience in the professional areas. And from the beginning, we had quite unexpected media coverage, which kind of boosts a little bit the guest numbers, but mostly now they are like users from the professional organizations, kind of stable traffic there, which they are sharing mostly naturally. So not much promotion actually.
Okay, thank you, Andrej. I hope that answers the question. We have received one more question in the Q&A section. It says you mentioned that digital platforms aren't friendly to people who are homeless. Could you explain what type of challenges they face here? I don't know if anybody would like to jump in on that question. I know from our paper, and I think Sergio mentioned earlier, the question of language. In some situations, migrants do not understand the language of the websites that they access, but also the way that the platforms are designed. Sergio, do you want to add something on the design of the platforms maybe, or?
Yeah, I can jump in briefly, and then if any other panelists want to give their opinion, it's perfect. So yeah, basically, in the case of migrants, we're dealing with language barriers. Also, some websites are not designed for mobile phones yet. Obviously, more and more websites are designed for mobile phones, but not many. And considering that access to a desktop computer is much more difficult for people in homelessness than access to a phone device, that is very important. Also, we have the problem to dealing with digital illiteracy and also literacy in general. For example, websites from public authorities who share administrative documents have a vocabulary that sometimes it's difficult to understand for the average population. So it's even more difficult to understand if someone has not appropriate access to a device, or for example, someone with a broken screen in the phone, which also happens for many people in homelessness. And if any other speaker wants to jump in, otherwise we can go to another question.
Yes, I can see that Sarah, you have your hand raised. Would you like to come in and answer?
Yes, yes. I agree with all the problems that point Sergio, and I'd like to add that at the Federation we tried to listen to the speech from the homeless, and more generally from the individuals living in precarious condition. And they also told us that the administrative websites lack from explanation about all the procedures and stuff, and it leads to an exclusion from this type of population, which are more generally at the center of a phenomenon which is called electronism. So this is a reason, another reason that shows that homeless people and individual living in precarious condition are not included in the digitalized world.
Thank you, Sarah. I don't know if Anka, you had the hand up. I don't know if you want to add something.
You already said it all, but I just wanted to say that we face, especially with part of our target group, homeless migrants, we face a lot of problems with the language barriers, especially Polish, Russian, Romanian, and so on. And the illiteracy is also a very important factor, because this combines to the lack of digital skills, and with the language barriers and the administrative websites in in Danish, for example, creates this digital exclusion. This is our experience, and yes, we believe that an app or something, we have Copen help, for example, but many of our guests do not use it because there is the language barrier. So we need to create something to include more languages.
Thank you. Thank you for underlining that. We received a very interesting question from Tom Lowe that says, Why is so much energy invested in the development of a digital platform for the homeless or digital access in general, when projects such as Housing First in Finland are demonstrably combating the problem in a much more sustainable manner than other attempts presented here, and thus making anything like a platform for the homeless obsolete? Is the focus on digital access really the right method to tackle the problem at the root? I think
Simona,
yes.
just to jump in, I think this one will be the last question because we are running a bit out of time.
Okay, thank you for that, Sergio.
May I answer, or in part answer that question?
Please, Jan.
So
Shortly.
the reality is that Housing First is being developed in the richer countries in Europe. So Housing First is a long, long way away in my country, particularly Romania, and certainly in my region. So although it's slowly creeping across from the richer countries, and it's slowly sliding over, but I mean, that is a big issue. And so in the meantime, these sort of developments and these interventions are really, really important, because it means that, you know, not everyone is left behind, that there are services that people can access which are relevant to the area in which they live. Thank you.
Thank you so much for that, Jan. Yes, I think we will now close the questions because, as Sergio said, we are running behind time, and we have our guest today, Ms. June Laurie Kingston, who will do a closing speech for us and tell us more about the work of DigiConnect. June, please, the floor is yours.
Okay, I hope I've unmuted myself. I hope you can hear me. I wouldn't bother sharing my slides, but I have got a couple of slides that we can share afterwards that have got some of the key links in. And I hope that you can follow what I'm going to say without the slides. The slides aren't very exciting. So thank you very, very much, Simona and Sergio. As I've been said, I'm June Lowry. I'm a head of unit at the European Commission, DigiConnect. My unit is called Accessibility, Multilingualism and Safer Internet. And I've been frantically typing things in the chat to everyone because I hadn't expected language to be such a topic. And I'm really interested in that. So I might ad-lib a little bit, but I'll try very hard to keep to my time. So the mission of the unit is to increase digital inclusion for persons with disabilities, to promote the development and use of language technologies to support language equality and help overcome language barriers, and to protect and empower children and young people online. And I'm also the equality coordinator for the Directorate General, and it's particularly with that equality hat on that I'm really happy and honoured to talk to you today at this conference. Now, as has already been said, even before the pandemic, life was increasingly moving online, and we see that now in the bill back. Some estimates say that the COVID-19 pandemic brought the digital transformation forward by 5 years, but certainly COVID has shone a light on the digital divide, the digital haves and the digital have-nots. And to take the obvious example of children's education, which is equally applicable in a different context to the homeless, the online classroom is not an equal classroom. Children's access to suitable devices, to the data packages and physical space for effective study can vary widely, even without considering individual learning styles and needs. And so fostering digital inclusion is recognised as being more important than ever, and it is a priority for the European Commission. And while the member states have that primary responsibility and competence to deal with homelessness, I'd like to talk to you just quickly about what the EU is doing on both the social and the digital agenda. So starting with social equality, in her political guidelines before she became president, the President Ursula von der Leyen called for a union of equality, for strengthening Europe's commitment to inclusion and diversity and equality in all its senses, especially the 6 formal grounds that are mentioned in the treaties. That's discrimination on the grounds of gender, racial or ethnic origin, age, disability, sexual orientation, or religious belief. And the fact that this commission contains the first ever dedicated commissioner for equality, I think reflects the strength of political commitment from the very top. And under the Union of Equality banner, the Commission has adopted several important policy initiatives. These include texts on gender and LGBTIQ equality, anti-racism, as well as equality, inclusion and participation of Roma living in the EU. That was in 2020. And this year we followed on with a new disability rights strategy, a comprehensive strategy on the rights of the child, including digital rights, and an action plan to implement the European Pillar of Social Rights. And as I'm sure many of you know, it's the final 2 of the 20 principles in the European Pillar of Social Rights that are probably most relevant to today's discussions. So Principle 19, housing and assistance for the homeless, and Principle 20 on access to essential services, which includes digital communications at present. Now, as a relatively new citizen of Luxembourg post-Brexit, I'm particularly proud to say it was under the Luxembourgish Council presidency back in 1997, under then Luxembourg Prime Minister Jean-Claude Juncker, that the first ever EU Social Summit was held. The second Social Summit followed 20 years later in Gothenburg, but that summit gave birth to the European Pillar of Social Rights under Commission President Jean-Claude Juncker. And we've only had to wait 4 years for the third social summit, which was held just 2 months ago in Porto and led to the Porto Social Commitment. And that text specifically adds the homeless in the context of equal opportunities. I won't bother giving you the quote, but I'll stick it in the slides. And the Porto Declaration, which also was adopted at the same meeting, sets out the EU leaders' vision for Europe's digital green and fair transition, and again mentions the homeless in the commitment to reduce inequalities and tackle poverty and address risks of exclusion, particularly vulnerable social groups such as long-term unemployed, elderly, people with disabilities, and the homeless. Now, the Porto Summit was also significant because the member states welcomed the revised action plan on the European Pillar of Social Rights, one concrete deliverable of which was the launch last week of this European platform on combating homelessness, which aims to support member states, cities, and service providers in sharing best practices and identifying efficient and innovative approaches, some of which probably we've heard today. So on the one hand, I think it's fair to say there is a clear political commitment to equality and the social agenda, and that is also reflected in the core values as part of the build back from COVID. If we look at the digital agenda, already before COVID, one of the Commission's top 6 political priorities was to build a Europe fit for the digital age, allowing everyone in Europe to benefit from digital technology. And this is also mentioned in your policy paper. Now, in some cases, this equal access is governed by legislation. So my unit, for example, manages the Web Accessibility Directive, which obliges all public sector websites and mobile apps to be accessible to persons with disabilities. And by 2025, under the European Accessibility Act, a set of key digital products and services from both the public and the private sector must also be accessible to persons with disabilities. And although I think it's fair to say at present the standards required are much stronger and clearer on technical aspects, such as screen readers for the blind, this obligation does cover access for those with cognitive impairment and those disabled by certain types of mental illness, who may indeed be a significant minority of the homeless population in the West. And there are other proposals of legislation which I think could be relevant to your work for the homeless. For example, the EC proposal recently adopted on a framework for European digital identity, and also the proposed regulation on harmonized rules on AI, looking at ethical use of AI, particularly in informing algorithms. And I certainly will be sharing the policy paper with the colleagues responsible for those 2 pieces of legislation. So we have legislation. We also have funding, where we look at research, innovation, and other projects to support the digital transformation. But this also includes projects looking at fostering equality, autonomy, and a diverse participation. So to give just a few recent examples that my unit manages, there is the Medici project, which if you're not aware of, I would really recommend you look at. This was examining inclusion of vulnerable and disadvantaged groups, including the homeless, in the digital society. And although the project has ended, the website is still live. For example, they have a catalogue of a collection of around 200 good practices identified in digital across Europe. We have projects looking at communication interfaces for persons with cognitive impairment, those with deaf blindness, and our work on language accessibility and language technologies looks at, for example, mobile apps translating between speech and sign languages, also multilingually, and language tools both supporting public administrations, but also preserving less widely spoken languages across the EU. And our last Safer Internet major event actually focused on opportunities and challenges of the digital life for children with disabilities. And there are different funding programs then also supporting investment to overcome the digital divide from a technological point of view, but also socially and geographically. So supporting digitization of public services, improving access to e-government, e-health, digital skills, very important, and also fostering the rollout of broadband in remote and rural areas, as was mentioned by one of the previous speakers, so that no EU region is left behind. And right now, in addition to the traditional funds in the EU budget, the member states can harness the exceptional funding under the Recovery and Resilience Facility. This is the special temporary instrument that was designed to overcome the economic and social damage from the pandemic. And there are something like 670 billion euros in funding available as loans and grants. And of that, the member states must earmark 20% for the digital transformation. And so this is a unique opportunity for investment and for really game-changing structural reform. And last but not least, there are policy measures. Now, as I see mentioned in the study, the EU recently adopted the Digital Decade communication, which I draw your attention to, because it sets ambitious targets around 4 cardinal points: digital skills, infrastructures, business, and public services. And some of these ambitious targets, to give you examples, one is for 100% of key public services to be online by 2030. And another is that 80% of the population should have basic digital skills by 2030. So obviously making that apply to all sectors of the population is really crucial. But the digital decade isn't just about these eye-catching targets. By the end of 2021, the 3 EU lawmaking institutions, so the Commission, the Council and the Parliament, intend to adopt a framework of digital principles to promote and uphold EU values in the digital space. And I'd warmly invite all of you taking part in the conference today to have your say in the ongoing public consultation, which is open till the 2nd of September. As examples of some of the areas where your views really need to be heard, I'd single out 3 principles that are suggested. Everyone, including the most vulnerable and with a disability or at risk of exclusion, should be able to benefit from human-centric and accessible digital public services at all levels. I think we've clearly heard cases where that is not yet possible for different reasons. Everyone should have the possibility to engage in the creation and the improvement of digital public services tailored to their needs and preferences. And everyone should submit their data or information only once when they're digitally interacting with public administrations across the European Union. So these are clearly relevant to some of the barriers as well as some of the opportunities that are identified in the study. So to sum up, while the main responsibility to tackle homelessness lies with the member states, the EU does have in place a range of instruments, policy, legislation, and funding to help member states and stakeholders tackle digital exclusion and its underlying factors from different angles. And there is strong political support for creating a social Europe that is fit for the digital age where no one is left behind. And in that context, your policy paper on digital inclusion for the homeless and homeless service providers is extremely timely. I've skimmed it. I'm going to study it very carefully. And I'm going to share with my colleagues, both in Connect and also responsible for equality across the Commission, both the reports and the insights I've gained today on digital inclusion measures, thanks to all today's excellent speakers from across Europe. So to finish, my warmest thanks to FIANSA for organising today's workshop and for inviting me to it. I'm leaving with lots of food for thought, and I hope you've all found it equally stimulating and inspiring. Thank you very much.
Thank you, June. Thank you for, for all your support. Apologies. It's very great to hear from you and to have this overview of policies and opportunities where we can fit in. I have also pasted the link in the chat to the public consultation that's going on until the 2nd of September. We will definitely make a contribution, and we invite everyone to do so either by contacting us or directly. I will not take more time from everybody because we've run a bit late, but I would like to say a big, huge thank you for your contributions, for being here today with us, and for confirming that this is an interesting topic, and we will definitely continue to work on it. Thank you so much. Have a nice day, everyone. Goodbye.
Thank you. Bye-bye.
Thank you. Bye-bye.
Bye.
Bye.
Thank you very much. Bye-bye.